My name is Dr. Keith Berg. I'm an anesthesiologist at the Mayo Clinic, and I'm going to be discussing the upcoming manuscript. It's going to be released in the Mayo Clinic Proceedings in July, entitled Diversion of Drugs Within Healthcare Facilities, a Multiple Victim Crime, Patterns of Diversion, Scope, Consequences, Detection, and Prevention. In this paper we discuss a relatively poorly recognized phenomenon of diversion of drugs from the healthcare workplace, and that it's becoming, I believe, an increasingly frequent problem is the epidemic of prescription opioid abuse that's happening on the streets of America right now finds its way into the workplace. Sometimes the people that are becoming addicted to these potent opioid narcotics, such as Vicodin and OxyContin, will work in a healthcare facility and become reliant on these drugs and find that they work at a place where they have ready access to these drugs if they're willing to steal them from the employer or from their patients. Unfortunately, that's becoming an, I believe, increasingly recognized problem, and that it puts employers at risk, it puts the addict themselves at risk, it puts our patients at great risk for suffering harm. As far as the scope of the problem, I'd say that's essentially completely unknown, other than that we seem to be seeing more of it showing up in the newspapers. I chair what we call the Medication Diversion Prevention Committee at the Mayo Clinic, and with that committee we've shifted from a passive role of waiting until these episodes arise to deal with them to a more active role of actually using electronic surveillance of prescribing records, prescribing practices, etc., to look for who are high users in certain areas. Are there outliers? And often those outliers represent people who are diverting from the workplace. As to what is the incidence and prevalence, it's completely unknown, other than that it exists, and anything more than zero puts our patients at considerable danger of harm. As regards the consequences of the drug diversion problem, it is clear from some recent newspaper articles that they can be devastating. So, sort of to talk about the worst case scenarios first, in the Denver area in the past several years, there was a surgical tech that was diverting fentanyl for her own use, injecting herself and putting the dirty syringe back into circulation for the patient pool, and by this means communicated her hepatitis C to 36 patients. It's a very devastating consequence. And there are other consequences that are less dramatic than that, but equal in potential harm. Other examples of potential harms are an anesthesia provider that is diverting the patient's pain drugs for themselves so that the patient wakes up in the recovery room in agonizing pain, having gotten underdosed on the narcotics that were intended to be given for the surgical procedure, to the patient undergoing colonoscopy who the nurse steals their drug, keeps it for themselves, relatively underdoses them so that they have a miserable procedure, not fatal, but unkind to the patient. Other consequences potentially for the employer are, of course, the potential medical legal risk brought about by the in worst case, spread of hepatitis C, or a patient who has an uncomfortable procedure as a consequence of being underdosed. The employer can be placed at risk of being accused of fraudulent billing if they bill for drugs that the patient never got. The addicted employee who's diverting drugs similarly puts themselves at risk for committing fraud by both charting that they gave drug that they know they didn't give, and by billing for drug that they know the patient didn't receive. The addict themselves puts themselves at great risk of accidental overdose and potential morbidity or even death from the accidental overdose. The detection of these drug diversions is very difficult, and the most important thing, we believe, is to look for it. If you assume that your employees are not doing this, you're going to be disappointed, and that there are some percentage of employees that work for healthcare facilities that actually are stealing drugs from the employer and from their patients. If you're not looking for it, you're not going to stumble across it very often by accident. And so it behooves all healthcare facilities to have some mechanisms in place whereby use records, prescribing records are reviewed, and in a perfect world, electronic medical record has ability to try to sniff out and detect high use patterns, aberrant use patterns, frequent return or wasting of full doses. One of the biggest problems and vulnerabilities for any healthcare facility is the trust that other coworkers have, and that they say that they witnessed somebody wasting their narcotics when they actually did not witness the waste, and that's a very common means by which people divert drugs. It behooves us all to have a trust but verify kind of approach to our coworkers. That I hate to advocate that we broadly mistrust one another in this area, but it behooves us to have healthy skepticism, and that there are good people and good workers and good coworkers that are actually stealing narcotics from us. As regards prevention of drug diversion, I think having a robust detection program in place that our employees know is robust and know succeeds at uncovering and dealing with diversions when they happen is maybe the best prevention there is. Just to know that if you decide to steal drugs from your patients or from your employer, that your employer is looking for this, they will find it, and you will suffer negative consequences, termination of employment, loss of license, things of that nature, that there are severe consequences to this. The FDA views any drug diversion as a tampering. Federal law is draconian when it comes to dealing with tampering. Diversion is tampering, therefore there are draconian federal laws that address diversion. People need to understand that before they make the decision to obtain their drugs from the workplace. I think the biggest take-home message is that this problem exists. It's always been with us. We haven't actively and aggressively looked for it in the past. As we start to look for it, we find it, and that all healthcare facilities should be actively looking for drug diversion in their workplace.
We hope you benefited from this presentation based on the content of Mayo Clinic proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.